Hello everyone, I am Dr. Prashant Bafna. I am a consultant rheumatologist and clinical immunologist at Bangalore Super Specialty Center, Vivipuram, Bangalore. Today we'll discuss about spondyloarthritis. Now, what is spondyloarthritis? It is an autoimmune disorder where your immune system affects the sacroiliac joint. Now, what is sacroiliac joint? The joint formed between the sacrum and the pelvis. This is called sacroiliac joint. What is the age which are most commonly affected by this spondyloarthritis? It can affect as young as 6 years to as old as 45 years. So it is usually a problem of young adult less than 45 years of age. If they affect the children between 6 years to 16 years, we call it as a GIERA, that is juvenile inflammatory arthritis and the that is related arthritis, or juvenile spondyloarthritis. What are the symptoms where a patient with spondyloarthritis can present? Classically, they present with a low back pain, which is more at rest or when they lie down for a long time, particularly at night when they sleep. Sometimes the pain is so severe that they need to get up in the middle of the night while resting. The pain is also more when you get up in the morning, and this pain is associated with stiffness. Pain and the stiffness improves with the exercise or the movement, and they also show a very good response to painkiller. Because of this characteristic of a back pain, many of these patients, they get over the counter painkillers and they try to manage their symptoms to an extent that where the requirement of painkiller is daily, or that even painkiller will not be working, and it is that point where they reach to a physician or a rheumatologist. And at that point this disease may be so severe that they would have already damage of the joint, particularly the sacroiliac joint, or the other complication like it can affect the hip joint. Now, what are the other symptoms other than the low back pain which a spondyloarthritis can present? They can present with the neck pain, which is more in the morning or at night. They can present with the pain in the mid back, particularly when they sleep at night or when get up in the morning. So these are called as axial symptoms of spondyloarthritis. Some patients, they can present with peripheral symptoms, means they have a low back pain or neck pain present or in the past, and now presented with the asymmetrical joint arthritis. That is, they have either the ankle or a single knee, or they have a wrist arthritis. So these are called peripheral arthritis. And these types, there are different types of spondyloarthritis like ankylosing spondylitis, psoriatic arthritis, IBD related arthritis, where a patient with inflammatory bowel disease, chronic inflammation of the bowel, can have an arthritis. There is, as I said, psoriatic arthritis. The patient have a psoriasis, either in the family or he himself had a psoriasis in the past or a present history of psoriasis. They can present with the axial spondyloarthritis or associated with peripheral arthritis, and other is the reactive arthritis and undifferentiated arthritis. Now, how do we diagnose this patient with the spondyloarthritis? The most important is the clinical diagnosis. If the patient present with characteristic symptoms of a spondyloarthritis, as I explained, plus what we get is get an X-ray pelvis, particularly to look for the sacroiliac joint. If the patient have a already established sacroiliac joint like grade 2 or grade more than that sacroiliitis, then MRI of that time is not required, of that joint is not required. X-ray itself is enough. When there is doubt that SI joint is not that clear, then we go ahead with the MRI of the sacroiliac joint along with the spine to look for any inflammation of the spine or the sacroiliac joint. MRI will be the gold standard if it shows an inflammation in the sacroiliac joint. Other additional tests many physicians would have recommended is the ESR and CRP. These are basically the inflammatory markers which get elevated in majority of the patient with spondyloarthritis. Others are HLA-B27. Now, HLA-B27 is majority of time positive in case of ankylosing spondylitis, like 95%. Whereas in psoriatic arthritis or IBD arthritis, their percentage decreased to 40 to 50%. So patient with having a spondyloarthritis features with negative HLA-B27 doesn't mean that he doesn't have spondyloarthritis. He can very much be a case of spondyloarthritis if we have the characteristic features with an MRI evidence of a sacroiliitis. Now, how do we treat? These are basically treated by a disease-modifying anti-rheumatic drugs. Obviously, majority of them physician will be using anti-inflammatory non-steroid anti-inflammatory medicines that called painkillers. But these are given for in short time. Along with that, we'll be giving a disease-modifying agents like oral medicines or is the sulfasalazine. If the patient is not getting control, they go to a biologics. Now, what complications you can develop if the disease is not controlled or disease is not recognized? The most important complication, if it is ankylosing spondylitis, you can develop the ankylosis of the spine, where your lumbar spine can get fused, cervical spine get fused. If the fusion occurs, it is a irreversible state. Hence, the diagnosis should be done very early and treatment has to be optimized if the disease is not controlled. Now, other complication which can occur is, particularly in young adult, is involvement of the hip joint, where majority of patient can develop hip joint arthritis. If you develop a destruction of the hip joint, the complications of the spondyloarthritis, the only management will be hip replacement. Hence, if you are suffering with low back pain, neck pain, do not neglect. Please consult a rheumatologist. They will try to find out whether it's any inflammatory arthritis, whether there are any red flags associated with low back pain or neck pain, which has to be managed early to prevent the complications. Thank you.